My guest on today's show is Dr. Yomi Olude of the Department of Hematology and Blood Transfusion at the Lagos University Teaching Hospital, Idiaraba. You're welcome to the show.
Thank you very much.
Those conflicting figures, we'll come to that. But first of all, apart from accident victims and people getting surgical treatment, and maybe those who have sickle cell anemia, who needs a blood transfusion? At least we've identified three: accidents, surgical, and sickle cell. Who else would be needing blood in this country?
Oh yes, so many other groups of people have various kinds of anemia. Anemia is not just limited to the sickle cell anemia like we know it. Iron deficiency is one of the world's leading causes of anemia. It's an irony actually. Iron deficiency is iron is the most abundant element on the Earth's crust, and yet people may fall short of iron due to diet, due to acute and even chronic blood loss. Other people that might be needing blood transfusions include people with malignancies, including solid malignancies and hematology.
Like cancer?
Yes, like cancers generally, renal cancers, breast cancers, prostate cancers, etc. Most of the time, the diseases progress to the part where they affect the bone marrow and then suppress blood levels.
That's it, the bone marrow.
Yes, and even then, hematological malignancies like leukemias. Everybody knows about leukemias and lymphomas, etc. So those are the major indications for blood.
Okay, so are you saying, because I was confronted with this kind of thing before and I was wondering, is age a factor? Like somebody is old, people say he looks pale, he needs blood, but it's not like his blood is leaking or he was in an accident or anything. So is that possible that maybe as people age, their iron gets less and they need transfusions?
Well, several factors would account for that too. With age comes reduced intake generally. The appetites are generally poor. Dentition is a factor. Not being able to chew meat and stuff like that, and those are where you get your high nutrients from for blood forming. Also, they might be susceptible to some other infections and even cancers in older age groups as well. So those are the factors that might result in lower blood levels.
But is it sometimes possible to just give the person iron?
Yes, most definitely. There are strict indications for blood transfusion. Not all levels of anemia. We have what we call mild, moderate, and severe anemias. Now, severe anemias that the body cannot, because the body has naturally been made to be able to cope with a certain level of blood cells. Now, if it falls short, the body is going to try and compensate. The heart is going to try and compensate for that loss and all of that. But when it gets to a point where the body says, uh-oh, I can't take it anymore, and, you know, now starts decompensating, starts having features of anemic heart failure, is excessively tired, is unable to do general work and all of that, and is assessed prior to blood transfusion, then that might be necessary.
Okay, now this disparity about more old people in developed countries getting blood, and then the under fives getting it in lower income countries, what's the cause of that?
Well, it's majorly as a result of infectious causes which we have in the tropics and in the undeveloped world. These tend to cause a lot of malaria is a major component of that. HIV/AIDS is a major component of that. Now, the attitude to health, the political will to supporting these programs and all of that add up to a lot of children not gaining access to good health care, not gaining enough access to good nutrition and all of that. So they tend to end up, actually anemia, or anemia generally tends to affect people in the extremes of ages.
Okay, yeah. Very young, very old.
Very young, very old. So,
but they seem to have got a handle of their young people, you know, in the developed countries.
Yes, I think it's a factor of political will, high standards in the healthcare system, availability of, you know, in our generally in government hospitals and all of that, you see people that cannot even afford to pay for the cards. The cards are probably less than 1,000 naira, less than 500 naira. They can't even afford to pay for that. So how do you imagine that they're able to even get good nutrition, prevent infectious causes from coming into their homes and all of that.
Okay, I know you classify your donors. What classifications do you use?
Okay, I'll start with the most acceptable one, which is voluntary unpaid donors. We also have those voluntary replacement donors, those that, okay, my relative is on admission, has had blood transfusion, and we have to replace because blood is not a commercial product. It's gotten from one human to another. So voluntary replacement donors, and then we have the unpaid, rather the paid donors. And of course, of these three, the WHO standard really is voluntary unpaid donors.
Yes, I know you love voluntary unpaid donors, but tell us, what are the shortcomings with the other types of donors? Why do you like the voluntary unpaid ones so much?
Okay, the paid donors usually are more high risk behavior. There are people that want a quick buck here and there to be able to probably take care of their intravenous drug abuse or other forms of abuse, and they are usually of a higher risk when it comes to infections. In addition, most of those donors do it multiply, more than the recommended rates of donation, which is about 3 to 4 times a year. Because they're looking for a quick buck here and there, they come more regularly, and therefore the blood is not even as rich as it should be for the recipient. That lowers the
standard of the blood?
Oh yes, definitely.
Okay. What about voluntary replacement? Isn't that good?
Yeah, that's fine, but it's not enough to build up the bank.
Too restricted.
It's not enough to build up the blood bank for emergency situations and all of that.
Okay, now, some countries have begun to report, or have reported for some time, that they have 100% of voluntary unpaid donors. What a record.
Yeah.
100% of all the blood they get, voluntary and unpaid. Where do we lie in all this? Are we usually voluntary unpaid, usually family replacement, or we're the paid type?
Well, the paid types actually are not advocated in the hospitals, but we do know that some racketeering goes on, and those people even come and pose as replacement donors for relatives and all of that. We are very far back in voluntary unpaid donors. I think we really need to put the word out there and let people know that giving your blood saves a life, saves up to about 3 lives, because the blood that is given, the blood that is donated can be processed and used to produce red cells, can produce platelets, can produce FFP, which is fresh frozen plasma for coagulation disorders and all of that. So
okay, let me make it simple. The plasma used to clot blood,
yes,
especially for hemophiliacs, right? Those people who can't clot their own blood.
Yes, that's one of the
do we do that here? You know, do we break it up into the different components here in Nigeria?
Oh yes, we do. Even in Olude we do that. Yes, we do.
Does that mean that if you had enough donations, we could internally deal with all the hemophiliacs we have?
Yes, most definitely. Most definitely.
But you know, sickle cell anemia is another ball game altogether. We have the highest burden. As at the last count, and that was long ago, 150,000 every year. Even if we do all our donations, unpaid donations, and it's a lot of blood, will that be enough for everybody who needs a transfusion, that is a sickle cell patient?
I think that would work. That will definitely go a long way in reducing, because the problem with maybe sickle cell anemia and the family replacement donor system, sickle cell anemia is a chronic disorder. Each time, maybe every month, every 2 months or something, the child has a crisis and needs to be transfused. You say the same family members that donated should come back and donate, and
that's just a month after.
You know, so they don't even qualify. So the family is at their wits' end. What do we do? And those touts, in quote, the paid donors, they're everywhere, and they're looking for how to infiltrate that. So if we had our blood banks filled with regular, voluntary, unpaid donors, people that choose to donate twice or thrice a year. You know, in Olude currently we're trying to build up a details of their date of birth. Like on your birthday, do something for humanity, you know. Donate to humanity, and possibly 1 or 2 other times in the year. If everyone that is fit can do that, you know, consistently, I believe our blood banks would have enough to go around.
Who is considered fit?
Okay, it's there are a lot of factors that are going into determining who's fit and who's unfit.
First of all, I know you shouldn't be a drug abuser.
Yes, definitely. Usually people between the ages of 18 and 60 years are fit for donation.
Okay.
People within the ages of 18 to 60 years.
So children are not allowed to donate?
Under 18, no.
Like 12 years old?
No.
Okay.
No, because they're in an active phase of life and they're rebuilding their blood cells and all of that. People unfit to donate, as I might want to quote now, are pregnant women, lactating mothers, because also their bodies are in a high physiological state and they need all they can get at that point. Other things we used to screen who might be fit might be the weight. Weights of above 45 to 50 kgs usually are fit, but we need to also take a medical history, and a brief medical history anyway. Find out, are you on any drugs? Was there any recent infection? Are you currently running a fever? And all a myriad of things go into determining who is fit for donation.
Okay, the gender profile now is another thing. All over the world, not just in Nigeria, it's said that women donate like 30% of the time and the rest is men. First of all, why?
Well, the answer is almost obvious. Women have their monthly periods. Not that the monthly periods
is that the reason why they don't come?
No. The reason why they don't come, it's sort of maybe like a myth, like the woman is losing so much blood every month, and so she doesn't have enough to give. In fact, if you hear people joking about blood donation, they look at your size. You're fat, that means that you have enough blood. Or you are too thin, that means you don't have enough blood. But it's not really a function of that. Then also women, of course, maybe pregnant, lactating, you know. You catch women at different phases of their life, maybe at just about 3 months pregnant, she can't donate.
Okay.
Throughout the pregnancy, she can't donate. Shortly after, she's lactating and all of that. So that's why. But women definitely can be donors and should be donors.